Lakshmi, we can get started.
Start now, ma'am. Good evening, everyone, and a very warm welcome to today's SIGPPO Academic Session. Thank you all for taking time to join us today. Today's session is especially meaningful as we mark World Psycho-Oncology Day, a reminder that cancer care must address emotional, psycho-oncology centers the voice of patients and their families, strengthening communication, coping, and shared decision making. Before we begin today's session, our sincere thanks to those who have helped make this session possible. Our gratitude to ICCI for providing the platform, to Dr. Rohini and Ms. Shivani for technical and social media support, to Mr. Vijay and Dr. Ria for corresponding with the speaker, and to our SIGPPO social media team for enabling this connection through their Mind Matters Monday feature. It is my pleasure to introduce our speaker for the day, Ms. Laura DeKraker Lang-Ree, parent, advocate, book, What Your Oncology.
If you're waiting for me, you're frozen.
Lakshmi, we've lost you.
Shall I go?
Yeah, I think, Laura, you can. I'm sorry about that.
No worries. Hi, everybody. Thank you so much for coming today. It's so cool to see all of you on Zoom from across the world, and it's really neat to be connecting this way. I feel very honored to be chatting with you about something we both have in common. So thanks for that lovely introduction, and I'm here to talk with you about creating better connections between caregivers, patients,
I'm
and
so sorry.
you.
I think there has been a technical issue from my end. I'm so sorry. I hope I'm
No
audible.
problem.
Yeah. We're especially grateful to Ms. for taking time out of busy to strengthen partnerships in care and shape more responsive systems of support. Open throughout the sessions. If you do have any questions, you can drop them down there, and there will be a dedicated question answer segment at the end of Ms. Laura's session. Thank you once again, everybody, for being here today. Over to you, Ms. Laura. The stage is yours.
Thanks. Hello again, everybody. If I didn't catch the end of it, because it was on my end, the connection wasn't great. So if I do anything out of turn, please let me know. Thank you again for that lovely introduction and for being here today. I'm here to talk with you about creating better connections between caregivers and patients, and you, the psycho-oncologists, pediatric oncologists, nurses, social workers, and palliative care professionals. And I think this is what you were saying too. In the spirit of that conversation, I humbly ask you that you be ready to engage with me. I have a couple of prompts along the way, things to throw into the chat, open times when we can just chat, and I'll let you know when I'm looking for your voice and your conversation, because it's really important that we all share this together. So I'm going to go ahead and share my screen, and we'll rock and roll. All right. As you might have gathered from the introduction, my life experiences have given me a lot of practice in hospital settings, developing my own really initially lacking advocacy skills, as well as collaboration practices for both myself, my aging parents, and my oldest daughter, Cecilia, who you see pictured there, who is a cancer survivor, and she is now 31. In California, which is where I am, I'm what's known as a cancer warrior mama. And later, I'm so curious what your families call themselves. I'm an advocate for empowering parents of children with cancer worldwide. and my new book, The Cancer Parents Handbook, was released earlier this year. I am thrilled to share that I recently received multiple Goody Book Awards, the winner in self-help and medical category, as well as a finalist in mind body. And because of these honors, I was also recognized with their prestigious Top Impact Author Award, presented to writers whose book earn a finalist or winner status in multiple categories. That was totally overwhelming and so awesome and deeply meaningful to win. It felt like true recognition from the outside world that somebody in the larger community gets what families and you and me are going through in the cancer space and how much support that we all need. Over the course of my child's 3-year battle with ALL and my dad's own battle with esophageal cancer, I saw a lot in the hospital and clinic settings regarding pediatrics in particular, and caregiver relations or lack thereof. And I've had my own recent experience as a patient prior to COVID times. My only experience in a hospital was the birth of my 3 kids, but in 2021, that all changed when I was medevaced off a small island in Washington for an obstruction. All of these experiences, but particularly the childhood cancer world, inform me as a patient, a caregiver, and an educator. And I realize that you, the professionals in the trenches, it might be a long time before you have a personal experience that it can inform your work, stories from the other side as a patient or a caregiver yourself that really shine a light on what it's like to live there. And maybe some of you got into this business because of your history as a caregiver or a patient, because I know those experiences really change you as a clinician and as a human. So that's why I'm here, to start the conversation about how to be more connected, medical teams, patients, and caregivers. Through my own lived experience in 5 years of researching the Cancer Parents Handbook, collaborating with current doctors, oncologists, nurse practitioners, as well as nonprofits and legislators as an ambassador for Leukemia and Lymphoma Society, one thing has become abundantly clear. Parents, patients, caregivers, and doctors, they all want the same thing: better communication, better collaboration, better connections. And I'm going to bet it's the same way for all of you too. That was most apparent when I gave my first draft of the Cancer Parents Handbook to Dr. Gary Dahl, who you see pictured there with Cecilia. He is a legend in the field of pediatric oncology over here. And my title's a little saucy, and I share all of the things we worked through together as a cancer family at Stanford Hospital. I was amazed to learn that the very concerns and frankly the frustrations I had about lack of time, communication, and connection frustrated him as well. And according to Dr. Dahl, the problem is everywhere and ongoing. Dr. Dahl became a treasured collaborator on the Cancer Parents Handbook and wrote not only the foreword, but a glowing review, which is validation for why all of us are here today. We want to make this system better, and it starts with communicating and connecting. So in our talk today, I'm going to be sharing stories from the trenches of caregiving, anecdotes from my work with hundreds of parents, doctors, and nurse practitioners. There will be moments of reflection, discussion, and a hope and request for you to share your experiences and thoughts with all of us in the chat or when prompted by just talking out loud. I really treasure and welcome your voices. Our goal today is to help you find ways to increase empathy, compassion, and collaboration between you and your patients and caregivers, and for you to walk away with some concrete strategies for achieving those goals. I aim to help you see the value of including caregivers and families on your team, maybe in a different way than you do now. And we're doing this together, and that's key. I want to make sure that you know I'm not coming at this from a you have a problem, so fix it kind of standpoint. I think it's the system and the way both patients and medical professions have fallen into a long history of not working collaboratively is the problem, not the people or the profession. I thought this was just an American problem, but I have learned that it's a global issue. It's a human issue. Parents and caregivers share the responsibility here as they tend to be either so scared of their diagnosis they can't speak, or simply don't know how to advocate and ask questions. And most often they feel a massive power imbalance with you, and that's not necessarily your fault. It's our society and the social constructs of class hierarchy. But because of that inherent power imbalance, I kind of think it's best to make big change starting with people like you, the practitioners in the field who are working so diligently in the cancer world and want to make it better. You get to decide who you want to be as a practitioner and a clinician and how you'll show up for the children and caregivers you're taking care of. So we're going to work through 5 pillars today towards building a successful relationship with your patients: understanding emotional load, building trust and partnership, communication best practices, home life, and simple gestures that build trust. And I'm a bit of a storyteller, so I'm going to start with a story about Anna. She's one of my former students. I teach high school, and she had non-Hodgkin's lymphoma 3 years back and relapsed just this year. She's a young adult, so while she has her parents' help and support, she's also trying to figure out how to relate to her care team as a grown-up. And it's been incredibly difficult. Cold is how she described the process of being treated for her relapse until she met the stem cell doctor. And I quote, "The way the doctor sat down and looked at me right in the eye with confidence brought back my lightness and brightness and my ability to get through this, especially when so much of the process is waiting and waiting. Cancer sucks, and it's so hard on a family. So when you actually are seen and given that human connection, it revives your fight. And my family also felt it. We were all lifted together in hope," end quote. We were all lifted together in hope. I thought that was incredibly powerful. That doctor really had no idea about the negative experiences Anna had already had with doctors on her team before stem cell prep, but he understood what she had been through and he related to where she was right now. And that made all the difference in the world. He saw her, understood the emotional load she was carrying today. He looked her directly as a human and reassured her with the words, "You can do this." So let's start to unpack the importance of understanding a patient's emotional load, which is pillar number 1, like Anna. You are all involved in one way or another when a family gets a tough and an uncomfortable life-changing diagnosis. And that moment is the start of a relationship that's likely going to last for a while. And that moment is the start of a relationship knowing that your patient and their caregiver are going through emotionally beyond what you can see is foundational to developing a positive working relationship with them throughout their treatment. When our child was diagnosed, I was already back at work after the morning blood draw that I had demanded, which confirmed that she had cancer. We knew shit was about to hit the fan, but we really had no idea that cancer was going to come out of anybody's mouth. Our regular pediatrician had been on vacation, and while she was present for the lab results, she chickened out and didn't even have the courtesy or courage to call us herself with the news that her patient, our child, had cancer. So in a matter of minutes, we went from living our life with our little family, from me working as a teacher, to becoming a full-time caregiver for our child's life-threatening illness with zero compassion. Talk about cold. This is a little excerpt from the Cancer Parents Handbook. Quote, "As much as you want to crawl back under the blankets after diagnosis day, life in the childhood cancer world quickly demands that you wake up, pay close attention, and become organized and knowledgeable as you ready yourself to take on the role of advocate and gatekeeper for your child's treatment years and follow-up care. And nobody tells you this is what you've signed up for, at least not in the medical business. Armed with good instincts, a pile of cancer books I frantically bought online, only one was focused on the medical side of childhood cancer, and the shared wisdom from an incredible bevy of warrior parents I found online and at our clinic, I slowly uncovered the truth. There is no roadmap for parenting a kid with cancer. That realization is paralyzing at least, overwhelming at best. We were admitted that afternoon and settled in for what? We didn't know, days, weeks? Cecilia got lucky, spending only 5 days in the hospital, where she received her diagnostic spinal tap, a bag of blood from her best of far, her grandpa, which she sorely needed as the leukemia made her white as a sheet. Watching that blood do its work was a gift, taking the edge off of my panic for a moment. And then suddenly, the nurse handed over her discharge paper, a chemo schedule, and said brightly, "You've got this now." And she briskly walked down the hall. I thought, are you kidding me? I sure didn't feel like I got it. Cue tears and a full-on freak out as I realized, holy crap, this is up to us, end quote. So in our experience, nobody checked in with us about our lives, whether we had a job, did we have help at home, or other children. Let me say, they did an excellent job of diagnosis, handing over the chemo, but then walking away. And we were lucky. We got a smile, but we weren't introduced to a social worker or a child life specialist, nothing. I'm sure that nurse also felt a sense of dismay seeing me cry, knowing I was completely unprepared and out of my element. But she had more newly diagnosed patients waiting for her down the hall. Something happens to any parent, to any person receiving a diagnosis, especially a life-threatening one like this. Life literally stops, and yet it doesn't. There are bills to be paid, other kids to raise, a partnership needing care, you as a human needing care. Everyone around us was buzzing, trying to save our kid's life. But I ask you, is that enough? What if I hadn't listened correctly? What if my husband had given her the wrong med? What if she wouldn't take her pills or do the shot? There were so many what ifs. And I remind you that this all began with my insisting to our pediatrician that we order labs because we could tell something was wrong with our child despite being told we were wrong. That was a totally chaotic way to be introduced to the world of cancer. Now, I'm just one person, and this is just one story. But over the 20 plus years I've been in this space, I've come to find it's not unusual. This sudden shift from parent to care coordinator, person to patient with zero training is totally disorienting. And yet it is so common. And that was maybe the sole inspiration for writing the Cancer Parents Handbook. I knew then, and I knew 20 years later when I wrote it, that something had to change because I think we can all do better. I think that starts by treating the whole person. This concept of treating the whole person, I don't know if you guys toss that phrase around too. It's not a new topic, but with the advent of AI tools and their medical impact, perhaps it's time to dig a little deeper. Perhaps this could give us the time, a little more opportunity to connect, to collaborate with our patients and caregivers. And everybody wins in that case. Every parent I've interviewed, the doctors with whom I've collaborated on the Cancer Parents Handbook believe there has to be a way to treat the whole patient or the whole child versus just the symptoms. Nobody I've worked with in the last 25 years on either side feels good about it, but it's not easy. And there are issues surrounding getting to know this whole person. My research has shown that there are a lot of boundaries around getting to know someone in a clinical setting, but I kind of narrow it down to the top three. I think these are the biggest challenges. Your patient's emotional state, because they can come to you in extreme fear, anticipatory grief. They might have decision fatigue or be completely paralyzed and sound really rude to you. There's advocacy challenges. Some patients and caregivers struggle to speak up due to perceived hierarchy, fear, or lack of ability to voice their feelings. I find here, that ability to advocate it just does not exist. It has to be taught or encouraged. And background. Collaboration challenges can also occur due to culture and gender. Maybe for your patient, it's not considered respectful or proper to speak up in front of a doctor. Language might be a barrier. And if they're not being asked questions by you that are open-ended, that encourage sharing, this kind of patient or caregiver really clams up. So here's the first point where I'd love to hear from you. I'd love to unpack some tactics that perhaps you're finding success with for working with the whole person while addressing those issues above. So I'm going to ask you to step into and imagine, and maybe you've experienced this, a patient's experience with a life-changing diagnosis. So you just gave that, or you just received, imagine you're that person. So the questions that I'd love for you to throw into the chat are, what questions or worries might this patient or parent have at this moment? What feelings or emotions might be coming up for them right now? And is there an immediate real world challenge that could be faced, such as childcare or transportation or paying for this? So I'm going to hold for a second and ask you to think of for another second while you throw them in, and then I'll stop sharing and we can take a look. phrase that could help the parent, a small gesture or phrase that you say to help the parent feel less alone or truly seen in those first few minutes? Anything that has worked really well for you? Just go ahead and mute and tell us.
I think at a lot of times when there's like a lot of questions or concerns or denial or shock, we just let them experience that and sort of provide them with that space where you are not bombarding them with questions or whatever they say or whatever they feel. You sort of just provide that space to listen and feel heard. Whatever concerns they have, it's completely normal to feel whatever it is that they're feeling, and that we're here to hold that space with them.
I love that.
Yeah, I think what I've also noticed is very often in our center, we are with the treating physician when they break the news. And sometimes there's no verbal communication. It's just a parent kind of looking at you, and you might just look at them and nod and say that, we'll figure this out together. It's just like that brief moment of maybe eye contact or a little nod which says, you've got this. And sometimes I think that itself goes a long way.
Oh my gosh, I can tell you from experience, it goes such a long way. Just that little moment, like an honest story of, I mean, it was gutsy too, right? Because he's the stem cell doctor. It could have worked, it maybe not. It did work, by the way. But he had the audacity and courage to say, "You've got this, and I'm right here for you," which I just thought was amazing. And you heard from her the impact that had. A couple people wrote in the chat, the concept, and I totally forgot about this. It brought me back, but the self-blame of parents. I got the chills. Like, why didn't I see this earlier? What suffering is there going to be? Yeah, all very real. Thank you guys. That was really nice. Okie doke. Okay. We talked about that. Our second pillar is the clinician-patient team building trust in some of those ways that you guys just shared with me. And that's Stacy Teicher. She's an amazing nurse practitioner, pictured here with Cecilia at her post-treatment celebration. I want to highlight Stacy because once our 3-year cancer protocol moved to the maintenance phase, she became our point person, which at the time I thought was really weird because I just figured we would be treated by her oncologist the whole time. But they need to go to the more urgent cases, and Cecilia was just, daily chemo, so Stacy came into play, and thank God she did. Stacy didn't have more time or energy than our oncologist, who was fabulous, but from the beginning, she made it a priority to actually know Cecilia. And I asked her why. She was a great collaborator in the book, by the way, so it was such fun so many years later to hear about her process. Stacy said she gets to know her kids because she wants them to not be so scared when they walk in the door. And two, so that the kids like Cecilia would trust her on scary days, like bone marrow aspirate day. And
journey.
Sorry about
yeah.
that.
Oh, no problem. If somebody wanted to talk, that was cool. So we're just talking today about stories about certain kinds of situations. There are so many. So anyway, how did clearly it might have been for a minute, maybe two. She would have jotted down already in Cecilia's chart what Seal was up to, and Stacy brought real joy to her work. She listened closely to our concerns, and more importantly, she never discussed frightening details in front of our child ever. She never called Cecilia sick. She always referred to her as in treatment. You're getting chemo, which I found really powerful because words matter. And it made a huge difference. And it taught me something profound, which was how to walk alongside trauma with joy. Today, as we talk about building strong relationships, like Stacy modeled, it's important to name the hard truth, kind of like the person who just spoke a minute ago might have been implying. Patients and parents aren't always easy, and different people walk into the room, and collaboration is a two-way street. Parents can most certainly be part of the problem. Society can be part of the problem. Studies show that across generations, most people still put doctors so high on a pedestal, for example, around the world that they'll freeze up in your clinic, and that's no one's fault. But here's the kicker is that in many cases, as a clinician, you walk into the room holding a quote higher status card to the person. And that dynamic alone makes many patients and caregivers either too intimidated to ask questions or resentful, so they stop listening, and neither work. You are the absolute expert on the disease and all of the situations surrounding the disease. And the person sitting across from you is the expert on their body, on their symptoms, and on their child's reality. So you need each other. One without the other doesn't work. Stacy put it this way. Providers, clinicians have a hard time veering away from their own agenda. Empathy is huge, but so is the ability to read a room, and that can be learned. She says, I have missed a lot of cues, but it taught me how to do better. It's good to show your human side too. Share a little about yourself. It can be something simple like my favorite color is yellow, what's yours, or recognizing the little things that parents are doing and how amazing they are. Personally, I believe in the power of optimism. It is possible to find the happy things in the worst of times. Find that silver lining and know there's always good behind the bad. End quote. So, what can we do to encourage patients to speak up and become advocates as you get to know them? I would love for you in the chat to thoughtfully write one, maybe two open-ended prompts or phrases that you can use to encourage your patients or caregivers, or that you already use, to speak up, to ask questions, to share with you, and just put them in the chat. If you have a thought as to how that empowers your patients to speak up and be treated more effectively, I would love to hear that too. Thank you. So I'll repeat the question. Do you have an open-ended prompt that helps your patients talk to you? And what's the results of what you see? Oh, that's such a great idea. Playing. Are you a child life person? Is that what they call it for you, Maria?
No, we don't. I mean, I'm not a child life specialist, but I work exclusively in pediatric psycho-oncology, so that kind of helps break down some barriers.
Playing a little bit.
Yeah,
Dr. Dahl used to always, he loved to blow up the glove. That was his way of sort of bridging that gap of getting people to lighten up and just sort of chit chat.
yeah,
How are you doing? Simple as how are you doing today?
yeah.
Anybody else want to just unmute and share their strategy? Oh, yeah, the basics. Are you sleeping and eating well? When you say most often acceptance takes a good 3 months, of getting the disease itself. Yeah, for real, or longer. That's awesome. Thank you. Oh, it's so good to say you look great today. What did you do? It's the medicine or the food helping you feel better. I love that. Yeah, it's just showing the positive. They could be as bald could be, but they're still beautiful. And saying that out loud is great. Acknowledging that it's difficult. How was your day? Asking about, oh yes, favorite things is great. And then jot it down. You're human. Who's going to remember that? Not me. Have it somewhere where you have a little cheat sheet. I think that's very helpful. I have that with my students as well. These are awesome. All right. Pillar number 3, communication best practices. What helps and what really doesn't? So I think it's never too late to develop practices for better communication that can help us and to use them right now. I do it as an educator myself. And I bet that you're here late at night because you want tools to do it better too, more efficiently, with more compassion. You're looking for new ideas as well. We all are. Every one of you has agency and the power to make a profound difference in patients and caregivers' lives. Whether you're a psycho-oncologist, a nurse, a social worker, or a palliative care specialist, you're uniquely positioned to develop strategies for how you want to show up differently with your patients and their families. And you don't have to have all the answers. What matters is the ability to point a parent or a child towards what they can explore to help them heal and survive this journey. I think that was one of the more surprising things to me, and I talked with it about a lot with Dr. Dahl. Like, why didn't you just say, I don't know, but you should explore this, or down the hall we have that. That's all I needed as a parent to move to the next step to see something. Too often, what parents tell me is that their clinicians just say, I don't think so, and shut it down, as opposed to just saying, I'm not sure, and asking them to explore elsewhere. Do you remember the You've Got This story from Cecilia's, when we left the hospital at first? What I wouldn't have given for just 30 seconds of a conversation, some direction, and even just that little empathy that some of you shared in the chat so beautifully, maybe a contact with another parent for guidance. Most patients and caregivers in similar situations are a puddle of anxiety and fear. So no trust is going to be developed because nobody's giving them the time. The Cochrane Review on Communication Training for med students found clear improvement in empathy, information gathering, and relationship building, especially when the students used approachable, patient-centered, and supportive language. It's interesting, Stanford Med School had me come speak to their third-year med students for just this reason, because at least out here, there's a push to really have specific classes for med students on the art of communication and connection, which is super cool. Numerous studies in medical education and patient care confirm that these communication tactics directly enhance patient understanding, their satisfaction, more importantly, their trust, and that means their treatment adherence because they trust you. So let's review some top communication tips that are easy and super effective. So, research in medical education shows that just using simple language and clear explanations boosts a patient's understanding. So speak really simple, pause often, encourage that eye contact so they'll talk to you. Encourage questions and talk directly to the person making that eye contact. Validate appropriately. Obviously, we can't over-reassure or minimize, but this strengthens trust and rapport when you can validate their feelings. Tone matters as much as content. I found this very interesting. Tone, the warm, open tone, as much as the words themselves, help patients feel safe and heard. In contrast, a dismissive, rushed, or arrogant tone makes patients withdraw, raises the risk of missed information, and can harm compliance, which is so interesting. So never cut off or interrupt patients and give them space to share fully. It's kind of funny, not funny. I experienced this myself when I was at a video doctor's appointment with a Stanford doctor earlier this month, who interrupted me so much during our video conference that I finally had to stop him and say, more than once, I stopped him and said, can I please finish my sentence? Because I was just trying to explain what was going on. It's okay to say, I don't know. Modern research and reflective practices across medical disciplines show that honest expressions of uncertainty, like I don't know, but I'll find out, they build authenticity. They reinforce that this is a teamwork between you and your patients, and they foster that trust. Interestingly, honest humility is consistently preferred by patients and families over guessing or deflection. I thought that was really interesting because we always feel like we need to know the answer, but patients, the research tells us they prefer honesty. Support patient questions by simply saying, that's a great question. That encourages active questioning and encourage the caregiver to feel empowered and involved, and deepens communication and might potentially improve how they handle their diagnosis. Dismissing a question, on the other hand, reduces connection and potential collaboration. So this research is telling us that clinicians, when they engage with clarity, empathy, and encourage meaningful questions, empower patients to participate in their care. The children, too. They feel safer discussing concerns with you. So these evidence-based strategies not only improve immediate rapport, but studies show that they might contribute to better long-term outcomes for both patients and providers, and certainly a better mojo about the whole thing. So we're just going to talk about a little story, just kind of an imagination kind of a thing. So we have this person, Dr. Lee enters the room to meet Ms. Gonzalez and her daughter, who just had a biopsy, and the results confirm a cancer diagnosis. Both of them look anxious. The daughter clutches a teddy bear. Pick two tactics you might use to have this conversation. What would you avoid saying and why? And or how could you acknowledge uncertainty and the emotions of the patient caregiver? Just pick one thing, and I'm down if you just want to unmute and just share. That's fine too. Or the chat, whatever makes you feel more comfortable. So to repeating the situation, we've got a new diagnosis. They're terrified. As somebody said, they're not speaking at all. What's a tactic you can use to open the conversation? What are you trying to avoid to say? How do you acknowledge their feelings? What are tactics that you've seen work or that are working for you? Oh, yeah, I agree. I don't know if this is for this question or an earlier one, because I think the chat's kind of slow on my end. But I got this to keep a diary that they bring in for doctor visits, 100%. Oh, the art of communication. I know, right? It should be. Tone matters a ton. Yeah, Teddy. That's cute. Yeah. Somebody suggested having, if they bring in, oh, because she has the teddy bear, ask what the teddy bear's name is. Avoid saying, don't worry, it'll be all good. I know we can't say what we don't know to be true, but we can acknowledge the fear. It could be a good opportunity to introduce them to what you have at your particular hospital that might make them connect with somebody else and feel better about their situation. That might be an option too. Avoid saying, don't worry, all will be well. Yeah. Ooh, that's a tough one. Yeah, I know. You have to avoid the false hope. It's so tricky because it's cancer and the statistics are not always good. So how do you empower them? Because I found with our daughter Cecilia, she needed to feel like she could kick cancer's butt. I found that to be important, that she felt empowered, and us too. And yet to not give false hope. It's tricky. I would make sure to talk well to the child, ask that she seems to be holding your teddy, establish a good relationship. That's all awesome. Yeah, and you could even use, we ended up using later on meeting at somebody who taught us the power of having, maybe you guys do this too, a play set where they can practice spinal taps and blood draws on their stuffies, which is awesome. Oh, I'm here. Amrita, I'm here with you through this. They need to know that. They need to know that you care, that somebody cares. Yeah, I agree. Somebody said avoid talking about fate or God because we don't know what a person's feelings and background are. So just that's probably not great. These are amazing. Thanks, you guys.
Hi, Laura.
Yeah.
Hi, I'm a parent to a
Hi.
child. Hi, to a child who was diagnosed at the age of 2.5, and we were treated at a private hospital initially, and then we moved to a public hospital in India. I would say that when you come with the news of a diagnosis to a parent, I would strongly says read the room because she had high risk metastatic neuroblastoma, and that meant that she was in a lot of body pain. Ward. And the doctor, very senior doctor in the hospital, pediatric oncologist, walks in, says, we've got her reports. This is her diagnosis, and my husband broke down.
Yep.
And my daughter instinctively started rubbing my husband's back because that's what you do to
Yeah.
children. And I asked the doctor, could he please
Yes.
step out? They didn't walk in with I'm not even sure if the hospital had a psycho-oncologist for that matter. Neither was there a nurse accompanying him. He just came in with a band of junior doctors. And I walked out with him and I said, could you repeat the diagnosis, number one? And number two, I asked him, will she survive? Will she live? Because he said stage 4.
Yeah.
And the immediate response that I got was, we'll do a couple of cycles and we'll see.
Oh, God.
And I categorically, till day, remember the time, the day of the month, and those words. They echo in my ears. And that was, my antenna going up saying, I don't think I'm going to, give my child in this set of medical hands.
Yes.
And this was one of the top rated, hospitals in the city of Mumbai. Um, and, uh, and, and, and that we'll see. And I just looked at him with utter disbelief and shock. And, I said, and I just said, okay. And the second question I asked him is, well, if you've treated children with this disease, you'd know because you definitely look 50 plus. And I couldn't hold myself back. Yes, in the country of India, we put doctors on the pedestal. We do.
So do
Right?
we.
Yeah. So, and he said one. And I just looked at him and I said, okay. That was my second antenna going up. And I just wanted to put it out there that the art of communication or reading the room is definitely not what is taught or what is ongoing. Unfortunately, as an ongoing, I think doctors, nurses, and other medical practitioners have CMIEs, and this foundation, the Indian Childhood Cancer, is trying to make a breakthrough because
Yeah.
just bedside manners. That's when I realized that it is so lacking. When you break such heartbreaking news to a parent of children, especially who's just started their life and not at the end of their life.
Yeah. You bring up.
So I just wanted to put that.
No,
I wanted to
that
put
was
it out
great.
there.
And I think that's part of the whole point of tonight is bringing parents' voices out to see what it's like, because I think that the trickier side of it, and I've heard this story so much over here too, the exact kind of story. And I think part of also the problem and what, it was super cool on the book to work with Cecilia's entire medical team. I mean, that was so full circle. And their lives are crazy. They have so little time. And also, they've gone through this incredibly hard medical school, this incredibly hard program. And as several of you have said, people are not teaching us patients how to be advocates and communicators, and they're not teaching doctors either. So it's a broken system. And hearing your story is, how is your
She's
daughter?
thriving with the grace of the universe, and we're very thankful because we moved out to another medical team in a public hospital. And I
Great.
am just so grateful that I took that call because I just said thank you to the doctor when he moved out. I said, thank you because all those red flags from you were great because I'm moving her. And so far, life's been looking up. And we're very grateful to the
I'm
medical
really
team
glad.
we have currently.
I'm glad to hear that. And I think what you're sharing with us is so pivotal in that the direct and honest and loving communication, to the extent that you are comfortable too as a practitioner, because you're a human too. It guides us towards resources that we can use when answers aren't clear and it's really scary. This open-ended stuff. Somebody said in the chat, validate it when a patient asks a question. They need a little help too. I love that. Like, that's a great question. Just that simple validation gets them to continue to ask the questions. And remembering that it is scary, as simple. You brought up something so simple, but it just took me so back. It's like, when it's scary, get out of the room, leave the kid to play, and let that scary stuff happen in a different. I appreciate your thoughts. Pillar number 4, why family dynamics and home life matter. So, understanding the ripple effect that illness has on family members, caregivers, siblings, and relationships is an incredibly important and often overlooked part of caring for that whole patient that we're trying to explore today. I've seen this firsthand caring for both Cecilia and my parents in medical settings. So, this is a photo of our little family right after diagnosis, and we look totally fine, right? We're smiling, we're pulled together, but the truth is we were a complete hot mess. And no one knew because no one asked. So, if our care team had just understood a little bit about what we needed and what life was really like for us at home, they could have done so much more than help us just get through the day, through that treatment. They could have gently and easily tailored support in making the whole journey healthier, more comfortable, and less stressful for all of us. So, a funny, not really funny story was when we hit consolidation for Cecilia's treatment. The oncology nurse asked Cecilia if she wanted to come in for her weekly methotrexate shot, which is super nasty in the thigh, or have her parents learn to do it at home. And she's 3, right? She goes at home. And I think her nurse knew that being at home was probably the healthier option for Cecilia and nudged her towards that choice. And you can't really say, no, honey, I'm not down for that, but we really wanted to for a hot second. But I can tell you that bringing home a load of containers labeled biohazard and being barely trained to forcefully impale your child with chemo in her thigh was daunting. You can't give her too much or too little. It's going to hurt a lot. And be sure nobody in the house, human or animal, touches the chemo. It's a lot to process. But what made it harder is that no one gave us any suggestions for how to actually do this in real life, knowing what we had going on in our home. And that could have just been a very brief conversation. So we just had to figure it out while managing a toddler, 2 cats, and a dog running around the house. There was no handbook, no, here's how you create a little safe zone or cheat sheet. It was just us winging it with trial and error and praying that we didn't screw up. We actually came up with just an amazing system that worked every time and shed no tears. And I share it in the Cancer Parents Handbook because I want everyone to steal it or have their own idea. The research is showing that patient and family-centered care improves children's physical and emotional well-being, reduces anxiety, and boosts parents' confidence, and make it easier for families to follow through with care. It turns medicine into real teamwork and lets families feel seen, heard, and supported every step of the way. And I think what I would have wished and a thought for you in whatever space that you're in is if a family has to do that on their own or they, however that works out, is give them an idea. Like if there's other children in the house, maybe they have a job in this. Maybe they are part of giving that shot, not literally giving the shot, but maybe they help it distract the other child, or maybe there's a lot of ways to do it that can make it into something that isn't terrifying for the kids, but fun. And I talk a lot about the power of a well-placed bribe, which I won't talk about here, but that might be a great place to encourage your families. Hey, well-placed bribe for that methotrexate shot once a week. You might consider that. I mentioned my mom really briefly. She's the best. She died last year. And for the last 10 years of her life, I was her medical advocate, watching her go from living on her own, driving herself, walking, fully independent, to needing a wheelchair and going to skilled nursing. And through all of those changes, I wasn't just her caregiver. I was the one who coordinated every appointment. I handled every move. I took on the emotional load that came with it all while caring for my own family and working a full-time job. And not once did anyone on Mom's medical team ask how it was actually all being managed or what kind of support I might need at home to keep her safe and cared for. So who cares? Why does that matter? Because my mom's health depended on it, because it depended on my action or inaction. So both of these journeys, I think they have something in common, and that's isolation. No one on either medical team ever asked me or my household, or about my household. And I've come to learn that silence is kind of universal, meaning there's a lot of isolated caregivers and families out there. And from what I've learned, this is a global problem. I don't think doctors necessarily realize it, but in a medical crisis like childhood cancer, it ripples out into an entire family's life. The siblings, your job, the school schedules, the marriage, and even the family pets all get hit. And if you don't ask, you won't know. And if you don't know, you can't truly make suggestions that will help a patient trust you more and be more compliant. I know this may feel like a lot to think about. I think it's a lot to think about, especially when your main job is to provide medical care as clinicians. And make no mistake, I have the most immense gratitude and thankfulness to our entire team for saving our child's life. But here's the truth. This kind of stuff we're talking about is care. If providers don't even know a little bit about the whole patient and what life looks like at home, they can't deliver what's truly safe or helpful. So when you ask, what does life look like at home? Who's managing this? What else is happening in your household? You unlock the real picture. And that's when your care plan starts to fit not just the patient, but the family system that's carrying out the treatment and often making survival possible. And the good news is engagement doesn't have to be complicated. Here's a few tips for getting engaged with the family. Know who's at home. Ask if there's siblings. Sometimes those siblings are dragged to these appointments and they hate it. So acknowledge them. If you have a little sticker system, give them a sticker. Give them a job. Madeline, our little toddler, her job, we would go to get weekly labs locally, and Madeline's job and the methotrexate job was to hold her sister's hand. And that little 15-month-old did it with ferocity. Never shed a tear. Her sister never shed a tear because they both had a job. And then they got to watch Dragon Tales. That was the big bribe. That's a fun TV show out here. Develop a relationship with your caregiver, because if you don't, the child's not going to be compliant. The caregiver has to connect with you. Encourage family to use mental health supports that you have in place. You don't have to be the expert in all of that. Just point them towards the help and acknowledge that they might need help. So many times the answers were right there at the hospital at Stanford, but nobody told us where to get emotional and logistical help that was waiting there for us. That's really important. There was this whole team waiting there to help us, and there was months before we knew about the social worker, the child life services, or anything else. Whenever possible, give kids and their parents choices, mostly your kids. When patients feel empowered, they do better. And when they do better, the whole family does better. And that might mean letting a child pick which arm they want for their shot, or asking if a patient would rather come to the hospital versus labs at home. And you'd know if that was an option for them if you knew where they lived. And encourage living life and being normal, which is counterintuitive. But as Dr. Dahl said, quote, people shut off when their child gets sick. Parents don't talk. Kids don't either. So I encourage parents to try to forget about the disease and live. Doctors and nurses can take care of the disease. A parent's job is to be present and to have fun, end quote. Dr. Gary. Hopefully, this helps you see more clearly that families don't just show up at appointments. They go home, they become the night nurse, the medication managers, the wound care specialist. We give meds at 2 a.m. Or in our case, you make burgers for when the prednisone hunger kicks in. We learn how to give injections, manage mobility challenges, and still have to get our kids to school, show up for work, and keep the household running. Quick question for you. Before we move on to this part, I'm curious what you guys do at this moment in time. Does anybody have a tactic that's really working for them to understand what a family's daily life is like? Or from this chat with people, is there something you want to try differently to get to know what family and home life is like? Is it as simple as just saying, tell me about your home life? Or is there something better than that out there? Do you have a go-to question to discover daily routines and systems without crossing your personal boundaries of, talking too much? Take a comprehensive history. Oh, is the comprehensive history, Ria, is that also personal stuff?
Yeah, Laura. So we look at like social aspects, where they come from, what they do, siblings, have they moved. So in India, very
Right.
often people have to kind of move cities because treatment is only available in kind of bigger metros. We might have lots of patients who come from more rural settings where they've just picked up their homes and moved. So we ask about work, finance, social details, basically anything that's psychosocial in
Would
nature.
you say that's common in India at all hospitals, or is that special where you are?
No,
Okay,
no, it's not. Yeah, yeah,
not common. So
yeah, not.
we still need tools. And Anu, thank you. Yeah, just as simple as tell me about your house. Oh, do you have a sister or brother or whatever? I mean, just as simple as that. And it sounds so I don't know, maybe it sounds so lame now, but we aren't being asked those questions for whatever reasons. So they're really important to ask because you can tailor something to a family and get them. We had people we knew in clinic who were not compliant about taking their meds because they did not trust their clinician because they didn't feel that they knew what was going on or they got too busy or whatever. So it's so important to build that sense of trust. What does your day look like? Oh, that's fun. Describe what a usual Sunday looks like in your home. Yeah, gets them out of yeah, that's a great idea. I love that. Okay. So, that's mom. That's that. All right, so pillar number 5, our last pillar in this evening as we are winding down, is to just remember that trust matters, just what we were just talking about. There's so much more willing to comply when we have a positive relationship for you. So here's some really easy, quick tips for small gestures that build trust. Some of you already said this. Ask about interests and remember one. Jot it down because you won't remember. I wouldn't remember. Treat the family and caregiver concerns with respect. Know that waiting is the worst. Every scan sends us into a spiral. So be sure they know when they'll hear from you and be timely. Celebrate everything. And like some of us were talking about earlier, that's so tricky because we can't promise anything, but you got to celebrate the little wins. Improved lab. Maybe they didn't cry that day when they got a shot. Are they back at school? Try a little sticker system or something that makes it feel like a little bit of a special treat and start now. Get your entire team involved. Speak directly to a patient, as we've discussed, and give them agency whenever you can. Give them a choice. And use empowering language like you're in treatment versus you're sick. We actually had one of our on our medical team say, well, you don't look sick. Oh, not great. Couple more. Know what resources are at the hospital. You've heard my story about that. And we were at a huge fancy hospital and no one seemed to know what was going on. So no, write it down, hand it out, send it in an email, text, whatever works. Never perform painful procedures without proper pain management. That's one surefire way. Even if it's faster for you, it's one surefire way to lose trust. And introduce child life services on day 1. Of everything we've talked about today, I hope you take away this more than anything, which is that you matter, not just your years in the field, but your connections and conversations, your humanity, and the mutual respect you develop with your patients is the thing that changes lives. Remember, the patient has an emotional load. Care is a partnership, so build that trust. Treat the whole person. Know there's a ripple effect on the family and use those small gestures that make a tiny, they're tiny for you, but make such a difference to us, like walking out of the room with scary stuff. Those small human gestures impact your patients so much and they change everything. And interestingly, studies show it's not just good for your patients, but it's good for you too as a human. And I thank you guys so much. Does anybody have anything else to share? Oh, some great comments in the chat.
I have one little thing that is bothering me. So my son is 16 this year, and he is 5 years since diagnosis stage 4 neuroblastoma. I think
Oh, Priya, yeah, I'm seeing you.
So what cancer takes away is, teenagers feel invincible, right? I don't know how to give that feeling back to him. I mean, I'm full of, did you take your vitamins? Did you do this? Did you do that? But somewhere there, I want to tell him, you are still invincible, whatever be the follow-up we are doing, all that. That's what really bugs me, more than anything else. That at 16 is when you feel you're Superman, Iron Man, everything rolled into one.
Yeah. Yeah. What do you wish was different?
I wish it didn't happen.
Yeah.
And don't get me wrong, I'm utterly grateful. He's mostly 100% fine. Maybe small
Good.
things here and there. But that fear is always there, right? Especially because it's neuroblastoma.
Yeah.
And he was so late diagnosis. So it's a big thing at 10 years.
And it's tougher with a teenager. I think you have to communicate more with a teenager as a
Yeah.
clinician because I teach high school. I know they're saucy. They know what's real. It's scarier
Yeah.
for them.
Yeah.
Thank you. Thank you guys so much for staying up late.
Thank you for doing this for us.
Yeah. Thank you so much.
Absolutely.
Thank you.
Do we have any questions or anything from the comment box?
Yeah,
That
I'm happy to
you-
stay on for a bit. And otherwise, I'm very grateful to all of you.
The forum is open if there's any questions or if anybody has put down anything in the chat box. Maybe a minute more and then we shall close the session.
I hope someday to do this in person. That would be more fun.
We would love that too. I think there aren't any questions as of now. Thank you, Ms. Laura, for a thoughtful and deeply valuable session. Your work reminds us how essential the preventive care in pediatric oncology and insights with us today. I would also like to thank our participants for interacting and for their contributions. Before we close, as we observe World Psycho-Oncology Day, today's discussion really reinforces the importance of integrating psychosocial care and psychosocial perspectives from both the family's end as well into cancer care for children and families. Thank you everyone for being here with us today. Thank you, Laura, once again. Wishing everybody a good evening. Thank you.
Bye.
Bye-bye.
Bye.
Bye. Good night.
Bye. Good night.